We're here at the Mexican Consulate to offer free cardiovascular health screenings for patients who have been known to be a targeted, underserved, socioeconomically disadvantaged patient population, in hopes of not only diagnosing patients and providing them with health screening that they wouldn't have otherwise been afforded, but in addition, implementing some health education on the management of diabetes, peripheral arterial disease, and other cardiovascular risk factors.
They will get blood pressure screening, make sure they're at goal, and then they also get cholesterol screening as well as diabetes screening, something called a hemoglobin A1C, to make sure if they are diabetic or not. And actually, having done these now several times, our average is about 30% of patients that we screen, we are finding they are diabetic and never even knew about it. We're doing something called an ankle brachial index, which is a blood pressure ratio of both the arm and leg, to see if they actually have stiffened blood vessels. That will tell us that they have hardening of the arteries and cholesterol buildup.
We have a bunch of UCSF Fresno Prime medical students. We have UCSF Fresno cardiology fellows. We have medicine residents. We have surgery residents. And so we are actually fortunate enough to be overwhelmed with volunteers who are here to give back to their community. For the med students to come out here and participate in this gives them that connection to their community. Most of these medical students are from the Central Valley. And so by getting them connected to their community, it really provides that top tier level care that the patients deserve.
For me particularly, I'm from the Central Valley, born and raised in Fresno, and my goal is to come back here as a physician. And so for me, it's a lot about learning about my community, like what are ways that we can support them and better provide these services so that we can prevent preventable diseases. So for me, it's a learning experience every time we do this. It brings me a lot of joy, but also, makes me feel like I'm also learning as much as I can so that as a physician in the future, I'm able to serve them the best that I can.
The whole mission of UCSF Fresno and us being here in the Central Valley is to provide medical education to our budding medical students, to our undergraduate students, to our high school students, and provide an avenue for them to get trained through our residency programs and our fellowship training programs. Programs such as what we have, our training programs at UCSF Fresno, is one that really provides education not only to our medical students and residents and fellows with the hopes that they stay in the area, but also provides education to our community as a resource to our area residents.
So I think that we grossly underestimate the socioeconomic disadvantagedness of the Central Valley. These patients do not have access to transportation. They don't always even know where to go to get health care. And so by going out into the community, by serving your community, you can give that patient that first step in cardiovascular health literacy and give them the basic information that they need to seek the health care that they do actually need in their PCPs.
I think it's incredibly important to have representation of the communities that we hope to serve, particularly in the Central Valley. We have a very large, diverse population, and only about 6% of physicians identify as Hispanic and Latino. And so I think for our community, it's particularly important, not just to alleviate that language barrier, but a lot of the cultural barriers that we have are better understood if we're able to accurately represent the communities that we are aiming to serve. And so my hope is that just being in this space, I'm helping patients feel more at ease and their questions are answered a little bit more than they would if they had a physician that they couldn't identify with as much. And so that's really my hope. And equally, it's to inspire other students to pursue a similar field so that we can amplify the effect.